and clear.
So ideally we make extra space with your dispatch for a 60-year-old male with sudden chest pain. You arrive, he's sitting forward, pale, diaphoretic. He says, "It feels like something just tore inside my chest." The pain started instantly. Max intensity from the beginning. It radiates into his back between the shoulder blades. Blood pressure in the right arm is 180 over 100. Left arm, 160 over 90. Heart rate's at 110. Respiration's 24. So, what are you thinking? This should make you consider an aortic dissection. So let's break it down. The aorta has 3 layers. In a dissection, a tear develops in the inner layer. Blood surges through that tear and splits the layers apart. Instead of flowing smoothly forward, blood creates a false channel within the wall of the aorta. That separation can block blood flow to vital organs, or worse, it can rupture completely. Now you have a catastrophic internal bleeding. Here's the key pathophysiology. The tear weakens the vessel wall, blood pressure forces the layers apart, perfusion to the brain, kidneys, or spinal cord can suddenly decrease. If the dissection involves the coronary arteries, it can even cause myocardial infarction. Our risk factors: long-standing hypertension is number 1. Also, connective tissue disorders, older age, and stimulant use. Classic signs and symptoms: sudden severe chest pain, described as tearing or ripping, pain that radiates to the back, blood pressure differences between arms, possible pulse deficits, signs of shock if rupture occurs. Now, what does the EMT do? Primary assessment first: airway, breathing, circulation. Administer oxygen if needed, keep the patient calm, minimize movement, avoid unnecessary exertion, rapid transport to a facility capable of surgery, monitor blood pressure closely. Be prepared for sudden deterioration, because here's the danger. The patient can look stable and then crash. If rupture occurs, you may see hypotension, altered mental status, the signs of hypovolemic shock. So the key takeaway: sudden tearing, chest or back pain, plus unequal blood pressures equals possible aortic dissection. A high suspicion, rapid transport, continuous reassessment, because in this emergency, time and pressure matter.